Hello everyone. Today we are going to discuss about ulnar nerve. First, you have to know what are the nerve roots of ulnar nerve. Those are C8 and T1. C8 and T1. You already know ulnar nerve arises from the median cord of the brachial plexus in the axilla. It is medial to third part of the axillary artery and it lies between axillary artery and axillary vein. Here you can see this is the medial cord and this is the lateral cord. This is the ulnar nerve. This is the ulnar nerve which is medial to axillary artery. In the arm, it lies medial to brachial artery. In the arm, it lies medial to brachial artery and then leaves neurovascular bundle at middle of the arm and pierce medial intramuscular septum to enter posterior compartment of the arm. It leaves neurovascular bundle at the middle of the arm and pierce medial intermuscular septum and it enters into posterior compartment of the arm. Here in the upper half, ulnar nerve goes in anterior compartment. In the lower half of the arm, ulnar nerve goes in the posterior compartment of the arm. Then it descends downward with superior ulnar collateral artery and lodge in a groove on posterior aspect of medial epicondyle. Here you can see it is in the posterior aspect of medial epicondyle. In the arm, ulnar nerve doesn't give branches to any of the muscle. It starts giving rise to branches in the forearm. This is the ulnar nerve course in the upper arm. Then let's have a look on ulnar nerve course in the forearm. In the upper one-third of forearm, it descends under cover of the flexor carpi ulnaris muscle and lies on flexor digitorum profundus. Here, this is flexor digitorum profundus. This is the ulnar nerve. You can see this is the ulnar nerve. It lies under cover of the flexor carpi ulnaris muscle and lies on the flexor digitorum profundus. Then it supplies flexor carpi ulnaris muscle and medial half of the flexor digitorum profundus muscle. In the distal two-third of the forearm, here in the distal two-third of the forearm, you can see ulnar nerve accompany ulnar artery. In the distal one-third of the forearm, you can see here about this from this level, ulnar nerve gives palmar cutaneous branch in 2 inches above the wrist and it gives dorsal cutaneous branch. Ulnar nerve is not a content of carpal tunnel. It crosses the wrist here. It crosses the wrist above the flexor retinaculum with the ulnar artery. Above the flexor retinaculum with the ulnar artery. Ulnar nerve is most medial and ulnar artery is lateral to the ulnar nerve. In the palmar surface of the hand, ulnar nerve lies lateral to the pisiform bone. At about this level, ulnar nerve lies lateral to the pisiform bone. It terminates in the palm by dividing into superficial branch and deep branch. Here you can see this is the deep branch and this is the superficial branch. Here, deep branch here and superficial branch here. Then the superficial branch passes deep to palmaris brevis muscle and gives branches to palmaris brevis muscle and sensory supply to medial 1.5 fingers. Here you can see these are the branches of superficial branch of ulnar nerve. Here this is one and this is bifurcate into 2. So it gives sensory supply to 1.5 medial 1.5 fingers. Then here you can see the deep branch of the ulnar nerve. This is the ulnar nerve, deep branch of the ulnar nerve. Here, superficial parts of the palmar surface of the hand are removed. It gives branches to hypothenar eminence. This part is the hypothenar eminence. This part is the thenar eminence. Deep branch of the ulnar nerve gives branches to hypothenar muscles. Here, these are the hypothenar muscles. They are opponens digiti minimi, abductor digiti minimi, flexor digiti minimi brevis. Here, these are the three hypothenar eminence muscles. And also it supplies lumbricals. Those lumbricals are only medial two lumbricals which attach to fifth finger and fourth finger only, and dorsal and palmar interossei muscles, as well as here there is adductor pollicis muscle. What are the muscles that supplied by deep branch of the ulnar nerve? Muscles of the hypothenar eminence. They are abductor digiti minimi, opponens digiti minimi, flexor digiti minimi brevis. Then medial two lumbricals and all interossei muscles. That means all four palmar interossei muscles and all four dorsal interossei muscles, as well as adductor pollicis muscle. There is adductor pollicis muscle here. It is also supplied by the deep branch of the ulnar nerve. Then we will discuss about the clinical correlation of ulnar nerve. When there is injury to the ulnar nerve at the level of wrist, we can see the deformity claw hand. It paralyzes the all small muscles of the hand. That means medial two lumbricals, all interossei muscles, adductor pollicis muscle, and yeah, those muscles are paralyzed, but flexor digitorum profundus medial half and flexor carpi ulnaris muscles are intact. Therefore, there is flexion of interphalangeal joints, but loss of extension of interphalangeal joints due to paralysis of lumbricals. When the ulnar nerve is damaged at the elbow joint, there is paralysis of all the muscles, including muscles in the forearm. That means medial half of flexor digitorum profundus as well as flexor carpi ulnaris muscle. Therefore, when the ulnar nerve is damaged at the elbow joint, there is no flexion of these medial two fingers. But when the ulnar nerve is damaged at the wrist, there is flexion of the medial two fingers. So you can see in the B picture, when the ulnar nerve is damaged at the wrist joint, there is more deformity. You can see more deformity than ulnar nerve damage at the elbow joint. So this is known as ulnarparadoxus. Normally, if a nerve is damaged at a proximal end than distal, there is more deformity. When the nerve is damaged proximally, more deformity is there usually. But here, when the nerve is damaged proximally, there is less deformity than the nerve damage in distally. Also, when the ulnar nerve is damaged, you can see wasting of hypothenar eminence as well. Wasting of hypothenar eminence. And also, when the nerve is damaged at the elbow joint, there is sensory loss along the medial half of the palm as well as dorsal aspect and both sides of 1.5 fingers. Here in this picture, you can see the cutaneous supply of the ulnar nerve. Here, palmar surface, here the dorsal surface. All the in both palm aspect and dorsal aspect, 1.5 fingers, medial 1.5 fingers is supplied by ulnar nerve. In the postdorsal aspect, dorsal cutaneous branch. In the palm aspect, palmar cutaneous branch and superficial terminal branches. You have to remember, in both palmar and dorsal aspect, 1.5 fingers are supplied by ulnar nerve. But rest of the hand in palm aspect and dorsal aspect, the supplies vary. So that's all about ulnar nerve and its clinical correlation. Thank you for watching.